Hello, Fairfield friends. This is Bob Ferguson, and I've been thinking a lot about a meaningful message I can make for everyone. In our community, we're blessed with many thoughtful and well-informed people who have the ability to sort through a blizzard of information coming from all sides about how best to respond to the pandemic and how to keep ourselves safe and healthy at the same time. The reason I decided to make this video is that quite a few people have asked me from the perspective of my Shackley business what I might recommend. And rather than lean into my own understanding only, I thought the very best thing I could think about doing was to invite Bruce Daggy. And Bruce, thank you very much for being here. Bruce was a former senior VP of R&D and Chief Science Officer at Shackley, which is where I got to know Bruce. Senior VP and Chief Science Officer at Nutrisystems. And before that, VP R&D at GlaxoSmithKline for many years, involved in the development of nutritional products, among other responsibilities. So as you can see, Bruce is a pretty well-informed guy. He had just arrived at Shackley, and we both quickly discovered that our mutual passion for all things sustainable and regenerative. I knew I had met a true fellow traveler. Over the past 7 years or so, Bruce and his wife, Ann, and I have become very dear friends. And it's been an amazing experience to watch them turn a nondescript, modest, sorry, Bruce, but it was nondescript, modest suburban home in Pleasanton, California, into a stunning model of energy efficiency, passing beyond net zero into the region of carbon positive. And then, after a number of years, yanking out the pool, zero-scaping the entire yard that is not devoted to food production, and going to work to grow literally hundreds. How many hundreds of pounds this year, Bruce? What was
close to 700.
Wow, so 700 pounds of vegetables and fruits. Bruce and Ann's example has begun to, in fact, probably a bad use of bad word, but anyway, in fact, so to speak, the entire neighborhood, as many neighbors are beginning to emulate their example. So I've asked Bruce to come and discuss a few key strategies for effectively negotiating this pandemic. First, by avoiding the infection to begin with, and at the same time taking steps to improve our overall health so our immune systems function properly should we become infected. So Bruce, again, thank you very much for being on with me.
It's my pleasure, Bob, and hello to all your fellow residents of the greater Fairfield area. I must get out there someday. I hear so many amazing things about the place. Oh. So the most important thing, and Bob has just introduced me as the nutrition guy, so kind of as a test of my sincerity here, I'm going to say nutrition is not the most important thing for COVID-19. It's important, it has a role to play, but by far the most important thing is for right now, what we can be doing is the shelter at home order and all the hygiene measures that I'm sure you've all been hearing for the last few weeks. These are the steps that we can take individually and collectively right now to buy more time for additional effective control measures to come into place. For us to have more masks, to have more and accurate tests, to have clinically proven cocktails of therapeutics, and maybe somewhere down the road a vaccine and other very important control measures that we simply don't have right now. So sheltering at home and the hygiene measures are absolutely the most important thing. The reason for that is that if you do not get the virus into your lungs, you will not get infected. And so avoiding contact, close personal contact, is a way to do that. There's also an issue that hasn't been discussed as much with viral load. So if you happen to be in a close packed crowd, sitting in a packed church or in a movie theater or in a bar or restaurant or a sports stadium or anywhere else, where you have lots of people around you, several of whom are infected and are maybe singing, projecting out the virus or cheering on the team or whatever, this is where you can get exposed to a very high viral load. And that's bad. If you get a small exposure, there's a better chance that your immune system will recognize that while it's a minor presence in your body, will start making the antibodies, will start preparing the defenses. If you get instead hit by a major viral load because you have multiple people around you and you're inhaling the viruses that they're shedding, then your immune system is more likely to be overwhelmed. And I think this is one reason that some of the people who seem to be healthy, were young, were surprisingly getting hit hard by this infection.
Some of them dying,
Including, yes.
the only people who die are not just old people or sick people.
Correct.
We'll talk about who's
Correct.
most likely to die and what the implications of that for our own behaviors.
Correct.
Anyway, so go ahead.
Yeah, so the viral load, again, I don't know why it's not being discussed as much, but this is one of the reasons. There was a public service announcement by the state of Ohio that's gone viral. Again, sorry, that's what we call it. That you may have seen with the mouse traps, and each mouse trap has a ping pong ball sitting on it, and a ping pong ball gets dropped from on high into this densely packed matrix of mouse traps, and they all spring. And then
Yep.
in the second showing, they're spaced out and the ball comes down and it bounces through harmlessly. It's a really good analogy for why we need to do the social distancing. Now, has to be said, the United States has not done this as well as any of the other developed countries. We now have the worst record in handling this crisis of any developed country. We have the most infections, the most cases. We have now the most deaths, and that's not a laughing matter. And I think it's partly, our stubborn streak of independence and not liking to be told what to do by the government. And believe me, I get that. We all have different reasons why we don't trust the government, whoever is in power. We all kind of jealously, guard our personal freedoms, including the freedom of assembly. So I get that. But this is a case where whether the governor is telling you to do it or you're deciding on your own, it's the right thing to do. Some years ago, I read an article. I'm a cyclist, a bicycle, not motorcycle. And I read an article about helmet laws and how helmet laws had a perverse effect of causing the number of bicycle injuries and deaths per mile ridden on the bike to go up. Because when you put a helmet law in place, fewer people ride, and therefore drivers are not as attuned to seeing cyclists around, and less attuned drivers are going to more likely hit a cyclist, right? So deaths per mile go up when you pass a helmet law. And I read this article and I said, oh, that's really interesting and perverse, but it's not a reason for me not to wear a helmet, right? Even if they pass.
As you well know from your experience.
Right, yeah, whether there's a helmet law or not, it's in my interest to wear a helmet. And I read that article and I went out and bought a helmet, and the next time I went riding, it saved my life. The helmet was destroyed and I'm quite sure I would have been killed. But I just, I was knocked unconscious and bleeding from all over, but I lived. And so this is like that. Whether the governor is telling you to shelter at home, or you're just coming to that judgment on your own, it's the right thing to do. It's the right thing to do for you. It's the right thing to do to not overwhelm our healthcare system. It's the right thing to do to protect the vulnerable people around you. So that is absolutely. The shelter at home and the hygiene things are absolutely the most important thing all of us can be doing and should be doing right now. And when we have more tools, then the economy can open up again. And, we can test people before they go to work. We can, have adequate control procedures in the restrooms and everywhere else that people are going to be forced to congregate. And we'll get going again. We will beat this. We will have more tools and we will beat this. It's not the end of the world. But for now, we really have to use those measures that are effective and can save lives.
That's great. Well, Bruce, I read an article comparing, this was done quite a number of years ago, long before this crisis hit us, but it was an analysis of what happened in 1918 with the Spanish flu. Which is, again, was a novel flu where the last pin drops and you have a flu that no one has immunity toward. And I think that kills something like 50 million people around the world. What happened in the greater Minneapolis area is St. Paul decided not to institute social distancing for about 2.5 weeks. as soon as this thing became apparent, Minneapolis just locked everything down, got everyone to participate, or the majority of people to participate. St. Paul didn't. It was only 2.5 weeks difference. The level of deaths in St. Paul was significantly greater. And for those of us who are most concerned about the economy in Minneapolis bounced back faster. And I have to think of, this, I won't quote the cartoon exactly, but there's these dinosaurs looking in this comet streaking down. And the one dinosaur says, "Oh crap, the economy."
Yeah.
So,
Yeah.
and it's not to make light of it. I mean,
Yeah.
I'm very, very lucky to have a business that is at home, and is actually, because of the nature of the products, booming. There are millions and millions of people who are facing desperate situations. So it's not to make light of that. It's actually to, first of all, save the greatest number of people and actually have the economy bounce back, because if more people die and there's more dislocation, the economy is not going to do as well when we start reintroducing. So we will do it, but we do, I think, absolutely need to pay attention to this, as you said.
Yeah, and again, we've not done well at it so far as a country. There are some states and some cities that have taken earlier action. I mean, it's no surprise to me that New York has been hit hard, because New York, you have very high population density. You have 3 international airports. It's a port. You have a lot of people on subways. It has a restaurant culture. I mean, it's like the perfect breeding ground, happy hunting ground for this virus. And, so if you're in a small town in Iowa or Wyoming,
Who would live
place,
there?
you might feel, and you would in some ways be a lot safer. It's going to be harder for you to be heavily exposed, but you will still be heavily exposed if you decide, I'm going to ignore all that advice, and I'm going to do what I've always done and congregate with lots of people, and it's not a good idea. Again, it's a tough thing for our country, kind of psychologically, especially to be told, but it is absolutely good advice.
It is really important. So then the question becomes, first of all, the most important thing is shelter at home. Don't get it, even if we eventually get it. If a bunch of us get it more spaced out, the healthcare system can handle us. If we all get it at once, then we're going to have a situation like, in many countries where they had the ration care, and people our age were just kind of said, sorry, we got to save the young ones. And that's not a very comfortable situation. So once we've done that, let's talk about how do we deal with our general health, and specifically the activation level of our immune system. Because as I understand it, when the viral load comes in, your ability of the immune system to react quickly has a lot to do with who wins, the virus or the immune system element. So talk to us about that. What do we do from a diet standpoint, from a lifestyle standpoint, from every other possible standpoint, to be as healthy as we can and to strengthen our immune system?
Great question. So let me take the helicopter view a little higher. Our bodies are incredible machines. They are capable of self-maintenance and self-repair, and you don't even have to be consciously thinking about most of the ways that happens. It's built in to the way that we and other living things work. Right? There are mechanisms to repair DNA damage, to clear debris, to rebuild tissues after an infection or an injury, an illness of any kind. So these mechanisms are there. They're why we can sometimes have a pretty unhealthy lifestyle, for decades, and we still live, right? Because we're so incredible in the way that our systems work. So, but you can think about those kind of repair and maintenance activities. If biology, kind of gets beyond you. Just think about anything, if you repair and maintenance of a house, right? Um, you can't do it if you don't have all the right tools, if you don't have all the right raw materials. If the right across the street today, somebody's getting a new roof on their house, right? So they need shingles and they need nails, and some of the plywood might need to be replaced. And I know they're going to put solar on when they're done. So that's another. That's
Your
another.
fault, right? Your
That's
fault.
right. Yeah, I'm talking to that guy. You need all the elements. If you're a stonemason and you have the bricks and you don't have the mortar, you're not going to build much of a wall. Well, so these systems in your body, it's the same story. We have to talk nutrition for a minute. We have a number of nutrients that are considered essential. They're essential because your body can't make them. You have to get them from your diet. Some of those are micronutrients like vitamins and minerals. Some of them are macro, the protein and essential fatty acids, and some are technically in the nutrition world not considered essential, but they're darn important, like dietary fiber. So the food that you're putting in your body every day is really critical for whether the repair and maintenance activities can take place. And in fact, I have an old nutrition book sitting on my shelf here that talks about one of the ways that malnutrition can be diagnosed is the failure to make antibodies. Right? If you are so malnourished that, and whether you're exposed to the disease or you're exposed to a vaccine, and you fail to make antibodies, that is diagnostic of a nutritional deficiency. You didn't have all the raw materials that your immune system needed in order to have a normal immune response. We're not talking about anything abnormal. We're not talking about pharmacology. This is just the way we are built to work. And so nutrition is one element. Not smoking, is a really important one. Men are dying more than women around the world. It might be this, that men are more likely to smoke, or that men are, working in environments where air quality is worse. We don't really know. It could be something Y chromosome related, but it could be as simple as, you're already doing something to insult your lungs. And that makes you more vulnerable to bad consequences. Clean air, clean water, clean food. Right now in Pleasanton, the air quality is stellar. It normally is not. We have big highways around here. The wind blows from the ocean, across San Francisco and into this valley where I live, and the valley traps the smog. We get smog every summer. We get high particulate counts. Normally this time of year, we might have some days with high particulate counts. I can count every individual leaf on the ridge 1.5 miles from me right now because the air is pristine. And that's one thing I hope we, not just us, I mean, around the world, Beijing, Delhi,
Yeah.
the industrial cities in Germany, everywhere you look up in the sky right now, where normally, Los Angeles has the cleanest air it's had in probably 50 years right now. That's the reduced cars on the road and reduced port activity. That'd be the two big drivers there. So that's something I hope we learn from this experience. That might be a silver lining of this experience, because around the world we get about 7-8 million deaths a year just from air pollution.
Yep.
Some of that is inside the house air pollution, people having cooking fires where they live, but a lot of it is outside air pollution. So, let's capture the memory of what's happening right now in our skies. And again, you can't always trust your government. Our government is busy trying to roll back fuel economy standards, fuel efficiency standards and whatnot right now while nobody's paying attention. That's a problem. That's absolutely the wrong direction. This is the time to say, wow, let's have more of that clean air. Let's have clean water. Let's have food that is not contaminated, so that we again can operate the repair mechanisms. Adequate sleep, I spent 20 years of my life jet lagged, flying around the world for my job. That I can tell you that takes a toll. Shift working takes a toll. But any kind of shortness of sleep quality, it's really hard. And by the way, if you start to feel like you have something coming on, whether it's a cold or flu or this virus or anything else, one of the best things you can do is just get in bed.
Good bed, go to sleep. Yeah,
Just
sleep well.
immediately give your body rest so your body can focus on fighting the infection. Don't wear yourself down. 2 years ago, we had a terrible fire season here, and for about a week we had the worst air quality in the world. And even though Ann and I started wearing our N95 masks and we were, inside our houses, you couldn't avoid being exposed to it. For the first time in probably 30 years, I got the flu. Yeah,
I can remember you were. I called you up, and
yeah, yeah,
it was tough. It
yeah.
was very, very tough. You were
Right.
for a while.
And there's always a possibility I would have gotten the flu anyway, but I'm pretty sure, that the stress that my body was under, it was hard. I went through weeks where it was hard to sleep. My lungs, my sinuses, everything was just, so devastated by all the particulate garbage that the fires put into my lungs, that I was overwhelmed. My body's ability to fight infection was severely compromised under those conditions. So anyway, get adequate sleep, adequate exercise, which Bob, I see every day that you're taking to heart, and stress management, which I know.
Working out with Bob, 8 o'clock. Be there, be there. 8 o'clock in the morning.
Yeah.
8 central every morning, 6 days a
Right.
week.
Right. So, and stress management, is something else that you've paid attention to over the years. So I think all those kind of diet and lifestyle things, the people who are dying or getting severe complications tend to be older. Well, if you're older and in America, chances are good you've been diagnosed with one or more diseases. You're on a handful of prescription medicines every day. That even might be, part of the problem, interaction of various prescription medicines. We know also people with diabetes are at higher risk, people with cardiovascular disease at higher risk. So it's beyond your immune system. You take this as one more reason to make your health the best that it can be, right? To build your health. So let's say your doctor has told you you don't have diabetes, but your blood sugar is a little high, right? You have pre-diabetes. You're on the path to develop diabetes. Maybe you have 20 or 30 or 40 pounds to lose. You're not eating the best diet you can. You're not getting, steps or whatever your preferred form of exercise is every day. Take this as an opportunity to say, I'm going to change that. If you're a smoker and you stop smoking, within hours, there are measurable changes in your body, within days, within weeks. So it's not like, oh, I've been smoking for so long, it doesn't matter. It doesn't matter if I quit. It always matters. And it's the same thing with improving your diet, improving your fitness program, improving your sleep quality. It all hangs together. All these things, it's one thing I think our healthcare system has encouraged us to develop a culture that's looking for the magic pill. The one thing that, I'm going to take this pill and then I can eat anything I want, or I can, I'll be fine. The way that nutrition works is all these little things, this vitamin and that mineral and this protein and that essential, fatty acid, they work together. You get a whole team of things working together that enables good things to happen. So the more of those enablers you can provide to your body to build health, the more likely not only will your immune system work, but all your systems will work better. And that's really what you want.
And finally, Bruce, you have as I counted back in your career, at least 30 years of being at the very top level of responsibility for constructing nutritional products. What are the criteria that you would, not thinking about any particular company, but just in general, what are the criteria that you would suggest people use in choosing something? Because my personal belief, and I think it's reflective of much of what I've learned from you, that because of the way, just multiple factors, it's virtually impossible not to go into deficit of some kind of nutrient. And so my plea to my fellow citizens is, at the minimum, just get a good quality multi-mineral, multivitamin, so you don't go into deficit right at the time when you need all those nutrients to make the immunoglobulins and whatever else your immune system is made of. So let's just kind of finish up on that little cautionary note. And what advice would you have for people in general, Bruce?
Yeah, so in terms of supplementation, I mean, first of all, I want people to eat the best diet they can. Most Americans don't eat the recommended servings of fruit and vegetable. I would say at least 5 a day. They're not eating whole grains. They're just, our diets could be so much better. So eat the best diet you can. But as you just suggested, even if you eat the best diet you can, there's a very good chance you have some nutritional gaps, particularly in terms of optimal nutrition. And people don't realize this. Those little numbers on the back of the cereal box, they're really, for the most part, I would call them basic hygiene levels of nutrition. These were figures that the government originally developed because they were concerned that in World War I, World War II, there were a lot of recruits who were coming in that they were having to turn away because they were malnourished. And so it was driven by military concerns to get people who were fit enough to serve in the military. And then it got carried over into school food and hospital food and other things that we don't think of as particularly high benchmarks, okay? There's a lot of data out there that says for certain nutrients, you really could benefit from getting more than the RDA. And so that's why I completely agree with you. I call it core nutrition. In terms of supplementation, start with a good multivitamin, multi-mineral supplement. And whatever is in there that your body had enough of, it'll get rid of the excess, but don't guess, don't read an article and say, I probably just need vitamin C, or I probably just need vitamin D, or I might not be getting enough zinc, or whatever it is that you've heard, or conjured up. Don't think that way. Start with something that is complete. If you are male and you do not have anemia, then you don't need iron. You don't need that multivitamin to have iron in it. And if you're female and you're postmenopausal and you're not anemic, you don't need iron. And you don't want too much iron. Too much iron is a bad thing. But so the big division is between the multivitamin mineral supplement that has iron and the one that doesn't. And you should be in the right category there. If you, particularly if you are older and you are not anemic and you take a multivitamin with a nice RDA level of iron, you're going to increase your risk of blindness. Okay, it increases your risk of age-related macular degeneration, among other kinds of damage that could do. So that's really important. Get the right variant in terms of iron, and get a complete one. And you'd be surprised. There are lots of products on the shelf. There's something like 1,400 supplement companies selling in the United States. There are supplements on the shelf that are calling themselves multivitamins that are woefully unbalanced or incomplete. So you want to get one that's actually complete. I think those would be the two most important things. If you're going to put a supplement in your body, you're doing it for your health. You're not doing it for the taste, or
you can't taste them.
the hedonistic experience. You're doing it for your health. So it darn well ought to be a good one, right? It ought to come from a reputable company that you can trust to do the right thing. So Bob, the company that you work with, has a lot of clinical studies on its website, for the work that they've done over the year. So that would be, if we're going to take one thing, I would start with a multivitamin. If you have if you have the budget to take other things, then it really starts to get to be a little bit of a question of who you are and what your risks are, and what's in terms of what's most important for you. And so that's becomes a little bit of a longer conversation.
Right.
I think a lot of Americans don't get enough omega-3. So that's one that I tend to recommend. And when I say omega-3, I'm talking about the fish oil omega-3s, the EPA and the DHA. A lot of Americans don't get enough vitamin D, especially in winter.
Mhm.
And again, there's evidence for some micronutrients like vitamin C that levels well above the RDA can be helpful in certain situations when you're fighting respiratory infections. I'm not saying that there's data for COVID-19 at this time, but there is a body of literature around micronutrient supplementation and immune function, and it's been developing for many decades. But I would again just come back, start at least with a multivitamin, really whoever you are.
Exactly. And Bruce, for our community where we have a fairly high percentage of vegetarians, not everyone. I mean, at home I'm kind of a functional vegetarian, but
Mhm.
I'll have a hamburger or every so often. But I don't include a lot of that kind of
Mhm.
animal product in my diet. Um, my understanding is that one of the other key nutrients for the immune system is adequate protein. If you don't have adequate protein, you simply can't make the proteins that your
Right.
your immune system requires. So some kind of supplemental protein product, plant-based, is
Mhm.
probably a good idea, isn't it?
Yeah, that's another one that the there is a minimum level of protein that is needed, and protein quality varies considerably across protein sources. And when I say protein quality, there are amino acids. Amino acids are the building blocks of protein. There are amino acids that your body cannot make, so they are the essential amino acids,
Right.
and you need them in a certain ratio. You don't need equal amounts of each of these essential amino acids, but
Right.
you need more of some and less of others in order to build the proteins that your body needs. So whatever form the protein was in when you ate it, it gets chopped up into the individual amino acids and then rebuilt into the proteins that your body operates with. And so for a vegetarian, some plant-based proteins are more complete than others. And one of the best is actually soy protein in terms of having the right ratio of these amino acids. You can also get there by what are called complementary protein sources. So peasant food around the world is a good model for what
Yeah,
works. Rice and beans.
exactly.
Rice and beans together give you roughly the right ratio. In general, uh, Ann and I are also, I guess I would call us flexitarians.
That's right.
We occasionally eat meat. We use it more as a condiment. We're not eating 16-ounce slab of steak at a time, but we do have meat several times a month, and we have eggs and we have some dairy. So we're not totally plant-based, but we're largely plant-based, and we have a lot of vegan meals, and I think they're delicious, and I think they're good for you.
I had one the last time we had a visit. We had a
Yeah,
bunch of people over
right.
at your
Yeah,
house, and we had this absolutely amazing vegan meal.
yeah. So so I think it's a very good idea to have a largely plant-based diet, and if you choose to have a completely plant-based diet, then that multivitamin I think becomes even more essential. Um, Vegetarian diets can be very healthy. Vegan diets can be very healthy. They can also be unhealthy. You can eat a lot of junk food
Yeah,
and have it technically be vegetarian, right?
yeah.
So having a bag of corn chips every day, or tortilla chips. Okay, that's vegetarian as long as it was made with a plant-based oil, but it may not meet the
Right.
nutritional standards that we're looking for. So again, multivitamin, and making sure adequate protein intake, and really we should all be so lucky as to have a personal physician who's going to work with us to actually help understand what our risks are, based on family history, based on individual history, based on diagnostic testing, including testing of nutritional status, testing of bone mineral density, cardiovascular function, everything else, so that you're focused on your issues, and then tell that doctor sincerely that you want to be part of the solution, that you're willing to take diet and lifestyle steps to address whatever your risks are. And that's your best chance. You're hopefully going to see that doctor once a year. You're going to see yourself every day. You need to be mindful of your health, do the self-monitoring, and try to build the healthy habits that are going to let your body do what it knows how to do.
Bruce, thank you very much. This was really, really enlightening. It's exactly the conversation I hope to have, and I hope it's useful for our folks here in Fairfield, and I think I'll probably use it well beyond, but I wanted to aim this at the people who I love and I know here in town. So,
okay.
Bruce, thank you very much.
My pleasure. Best of health to all of you.